Welcome to the MEND, a podcast to learn about services and support for victims and survivors of crime, sponsored through the Center for Crime Victim Services here in Vermont. I am your host, Anna Nasset, and today on the show we have Dr. Alexandra Kalof. Correct? Kalof?
Yes.
Okay. This show was created to take a deeper look at services and support and organizations and concepts for victims and survivors of crime. We want to acknowledge the healing process and provide resources not only here in our state of Vermont, but throughout the country that could benefit victims of crime as they begin to mend. And today we're going to be looking at some of those things as we share a story and look at community justice as well. This is a show where we can all learn, myself included. We may not always agree with everything we hear, but we learn, and I invite you to learn with me. I always want to begin with a content warning. Our goal is to create a safe place to discuss topics of healing, but with that in mind, we may occasionally hear a story related to crime, discuss our mental health, or have sensitive subject matter. I urge you to listen at your own discretion. As I said, today we have Dr. Alexandra Kalof, who is a professor of pathology and laboratory medicine at the University of Vermont Larner College of Medicine. She's the laboratory director of anatomic, oh my goodness, pathology at the University of Vermont Medical Center and practicing surgical pathologist. She completed her anatomic and clinical pathology residency at the University of Vermont Medical Center and a fellowship in surgical pathology at the Stanford University in Palo Alto, California. While a generalist at heart, Dr. Kalof specializes in bone and soft tissue and gynecological pathology. Having served as vice chair and division chief of anatomic pathology in the University of Vermont Health Network through the COVID pandemic and the 2020 cyber attack, she has a passion for laboratory management with a specific focus on organizational structures, lean process improvement, and change management. So basically, folks, she's smarter than all of us.
That's a mouthful.
I know, it really is.
A bit more than we need. Sorry.
So, well, not generally the guests I have on here. There's a reason you are here today, and I'm so glad you are.
Thank
Alex
you.
and I had a chance to meet through a Zoom meeting last year, I believe, and had a lot of interesting connections, including a neighbor of mine, and have gotten to do a little bit of work together, and I'm so happy to have you here today.
Thank you so much. It's an honor.
So unfortunately, the reason that you are here today is we have a very similar shared experience of being victims and survivors of crime, specifically the crime of stalking. And so thank you for coming on and just your voice, not only here today, but what you've been doing with your voice to look at change. And I'm very welcomed to have you here today.
Thank you. It's a pleasure.
Yeah. So to the extent that you're comfortable with, would you like to share a little bit about your story and how you came here today and how we connected?
Sure. And I'm very grateful that you have been in a similar experience, because I think that this sort of discussion is both therapeutic but also challenging. I was driving in, and the waves of memories and having to share the story is it's hard. I think we tend to kind of compartmentalize and have to move on with our days, and it's both an opportunity but also a bit of a challenge to focus on the feelings.
Yes.
So I'll try to be focused, but also, understand that it is an emotional journey. So I am a mother of 3 young girls and a professional, as we talked about, and very busy, and had an incident of stalking, and it was someone I knew and had a relationship with previously, and we had been friends for 5 years, and he was integrated into our lives, and it was, you had these glimmers of, this doesn't feel right. Something's off. This is, bordering on, toxic type relationship. And long story short, it eventually was left with a no contact. I went no contact with this individual a couple of years ago. And once that happened, the gates flew open, and he just was very angry and threatening. And I was in a new relationship, and so he was threatening not only that, but also my professional career. He went on a full-fledged smear campaign and, created accounts on Twitter and, blasted false information across, numerous channels, including getting my, professional supervisors involved and, just higher level leadership in the hospital. So with that, reported me to the medical board of Vermont with false accusations. And luckily, I was able, with the help of the justice support at the hospital, able to respond to that. But ultimately, though, that was transferred to the state's attorney's office, and it was within months that the Justice Center actually, they contacted the Justice Center, and they read through the issues and felt that they wanted to step in and support me as actually a victim instead of a perpetrator,
because you were
of
being
false
accused
accusations.
of, yeah.
And so it was an incredible blessing, because they essentially were able to approach the case from a victim's perspective, and really advocated for supporting me, and so pulled me in essentially to I thought it was going to be a like almost a punitive type situation, and in fact it was the exact opposite. It was incredible support, because they were able to see really the injustice of what was going on,
Yeah.
and how powerless I was in that situation. I was so fearful for my job. I was fearful for my my family, my kids, everything, because you're really powerless in the system that exists. And really what I left out was, in the meantime, while all of this was happening, I had gotten and been granted 2 temporary relief from abuse orders from the state. So, but I was in a very long process of trying to have those finalized, and had invested a tremendous amount of money in legal fees to fight for a final RFA, to protect me and my family. And ultimately, they were denied, because it was essentially a lack of concrete evidence that that I was in. There was risk of physical harm.
Yep.
And despite 9 months, tens of thousands of dollars trying to fight for this, the ruling from the judge was no, in favor of the defendant. So to have a light and a support through the Justice Center was incredible, and I'm very grateful for that. So I kind of skipped around, but that's basically
We'll get
the
back
story
through
in a
it.
nutshell.
Yeah. You don't need to go through the whole story. That's why I said what you're comfortable with.
Yeah.
I think, the point of a show like this is not to dredge up our whole
Sure.
story, but really to talk about the services that worked and the things that didn't. And as a stalking victim, survivor, advocate, activist, specifically here in our state of Vermont, I cannot tell you how many emails I get from people like yourself that the judge does not grant the RFA because of lack of physical harm proof. And I'm talking people who've gone through horrific domestic violence, having their medical license tried to take. We have somebody that I've connected you with in common that's in a similar situation, and it's horrible. Like, it really is. And it's something that I know I would like to see shift and change, but it's very specific to our state, like how uneducated our judges are. And so I'm sorry you had that experience. I often say, I'm never glad I was a victim of stalking, but I'm glad I was in the state of Washington. Like, it's really sad to say that, but yeah, so I'm so sorry for all you've gone through, and thank you for being here.
Thank you.
You know, one of the things I heard, and you and I, we did a talk about a month or so ago, and I mean, I think we can all acknowledge our own privilege within these situations too, of being like, this is so unfortunate, this is so, like, there's nothing okay about this, but there's a certain amount of privilege, right? Yeah. But even within that, like, how your basic needs were still called into question, of safety, of employment. I talk a lot about, like, housing, food access, because I couldn't go to my grocery store because he would be there. And so thank you for acknowledging that. And I think it's something that people really need to know about stalking is it doesn't matter what our profession is or where we are, like, basic needs are called into question.
Absolutely.
I don't know if you want to speak more to that or...
Yes, absolutely. And, you know, from a position of privilege to be able to pay for legal fees and hire a lawyer to fight, that still wasn't enough. And so I think it does level the playing field, and it really makes us, I think, exceedingly aware of the damage that this fear and trauma can do to people and their nervous systems. And what I find really hard to wrap my brain around is, you know, when they ask if there's physical abuse, there is, because it is abuse to the physical nervous system. And it's, I mean, I have, you know, no bruises, no broken bones to show and prove it, but internally, the effect is enormous, and that terrifying experience that you're reliving constantly. You know, you're never knowing if it's going to happen again. If, you know, like you said, if you're showing up and you know, you're fearful for your safety and your family's safety, it's cumulative, and it doesn't dissipate. In fact, I think it grows. And I think, you know, and I fully acknowledge my experience is nothing compared to other victims, you know, that I have talked to. And we, you know, I mean, nothing.
But can't compare.
But, I know, it's all relative. But to experience that and have to, you know, live your days still and try to compartmentalize that. I tried for about a year, and I finally, in April, I applied for a leave of absence because I was not able to function the way I wanted to or should function at work. And so, you know, that has been a really important change that I've made, that it's been now a focused effort to heal, but I've had to step out of my profession, and it's scary because I don't know about, you know, the reentry, you know, financially, you know, there's a lot of things, but I wanted to prioritize the healing process, and it's very difficult.
Good for you.
Yeah, so
that's it's a big, bold, scary step to say, you know, I need to heal what's inside.
Yeah.
And
yeah,
I remember, you know, I don't normally talk that much about my own story, but because we have a similar shared experience, I remember, like, my prosecutor being like, I'm going to try and prove the unseen, and how powerful that was to me.
Oh, that's great.
And even the judge that oversaw, like, the trial, being like, you know, I'm going through and I'm looking for an injury that doesn't have physical evidence. And I really liked that he likened it to, he's like, you know, if there's, you know, a crime in front of me that's a mailbox that got smashed by somebody, I can see the mailbox before and I can see the mailbox after. And I can see the evidence of the harm. And I really will always remember that, because it wasn't, he didn't use a body or a human. He used a mailbox as the
Yeah.
metaphor, and I was
Yeah.
like, that's a really
Right.
good way to look at it. And
Yeah.
he's like, the mailbox was still smashed.
Yeah,
And
yeah. I
yeah.
mean, I like to think of it too, you know, comparing it to someone who's just had, you know, a major motor vehicle accident, you know, broken numerous bones in the hospital, trying to heal. You wouldn't go to them and say, okay, you're ready, get back
Right.
to work, you're
Right.
fine.
Exactly.
You know, we don't honor the inner damage and the inner injury.
Yeah.
And it is real, and it is organic and somatic. I'm convinced of that. So
Absolutely. As a doctor, I mean, you're in a very interesting role, not only in your experience. So I've got a couple questions around that, but based off what you just said, what has it been like advocating for patients while advocating for yourself, who victim, survivor, also patient in that situation, right? Mm-hmm. What was that like to have to balance?
yeah, I have to admit it was hard, and ultimately I think too much. You know,
Yeah.
I think going to work. There's such an investment of concentration and energy, and you know, they talk about like the empathy fatigue, and really, I mean, I diagnose cancer every single day, and we have to also compartmentalize some of those things and not get too involved, you know, so that we can be objective. But I think that I was starting to notice, you know, the effects at work, and really in that almost, you know, the post-traumatic stress, and I think that it's hard to hold both, because the advocacy for patients is so important, and we have to, you know, have all of our concentration. And I think that my colleagues luckily saw that and see that with numerous physicians. I'm not the only one. I mean, experiencing burnout, you know, physicians have experienced that, which is, I think, also a neurologic, you know, nervous system impact. And, you know, I think being able to support, and I did receive that support, luckily, from my colleagues, and was able to, you know, exit and, you know, do the healing that I needed. But I do think when you enter, especially a profession like this, you know, you feel strong, and, you know, you have to be there, and
You hold the knowledge.
yeah,
You hold
right.
the power. Yeah.
It's hard. It's hard to feel and express vulnerability, because you have to. I always tell my trainees, you know, ego is such a negative thing that we talk about, as far as, you know, the hubris, and, you know, and the negative parts. But part of going to work every day is ego. Like, you have to have that ego, that confidence to make diagnoses, to support, you know, the patients, to be able to, you know, have difficult conversations, you know, work through pretty chaotic circumstances right now in healthcare. So you do have to hold that, and with that is a bit of, you know, shutting down that vulnerability. And so when, you know, this happened for me, you know, it was sort of bubbling, and then finally at the surface, it was, you know, I realized that it was just, it needed to be addressed. And I think that ultimately, at the end, like you said, I think I know I'll be in a better place, you know, because I'll be able to identify better and be able to express that vulnerability with the courage of, you know, having experienced and gotten through the process.
Absolutely. Yeah. I mean, I have so many questions, but I'm like, so within, like, especially because of being in medicine, like, I'm starting to hear from more medical professionals who are being stalked because of the practice, whether it be a patient, former partner, whatever it might be, that their offenders are leveraging that position and stalking through that.
Yes.
And
Yeah.
is that something you're seeing more of?
I don't. Yeah, I think it has, with the onset of social media. You know, the accessibility of disseminated information, and no one knows if it's true or false, and people can disseminate false information.
Yeah.
And that can be incredibly damaging to anyone's reputation, but for physicians and healthcare professionals in general, it's critical to maintain that, through your license and your credentialing processes. We do, as a whole, I think, feel extremely vulnerable to that attack, because that's our livelihood, but also our passion. And it is. There's so much also, then it's a catch-22 as well, because if you're dealing with that, then you have all the the mental health issues that accompany it, and then the stigma associated with that. Mm-hmm. And then it's and then that concern as far as the vulnerability of any sort of stigmatized mental health issue that you might encounter in that post-traumatic stress incident. So it's really, it is a tough place to sit, I think, for healthcare professionals. And I would imagine for any, high visibility profession that requires certain, standards of review yearly, licensure, and credentialing.
Yeah, I was doing a training last week, and it was with military. It was military leaders.
Mm-hmm. Oh yeah, exactly. Yes.
Like I had someone email me afterwards. They're like, I didn't realize I've been stalked for years.
Yeah.
Yeah. And that was really poignant to me but I think that as we're talking about specifically this subject of stalking, as we talk about it more, people are becoming more aware of what it is and how damaging it is. Mm-hmm. Have you felt supported by your colleagues through this process?
I have. I definitely have. I'm because of the vulnerability I felt and the excess information and false information that was out there, I was very closed off. I didn't want to share a lot, and I still haven't really to the full extent. And plus, I think when people hear it, they're kind of mind blown. They're kind of like, "What? Like, how could this happen to you? How could this happen to you?"
All the stuff. Right. And yes.
Or alternatively, people say, maybe you made poor decisions, or maybe
all the victim blaming.
Yeah, the victim blaming.
What could you have done differently? Nothing.
Right.
I didn't decide this. That person did.
Yeah. And so it really, and you want to show the face of strength and not vulnerability. So, but I think seeing the effect of the stalking over 2 years. My colleagues were extremely supportive. The staff at the hospital were supportive. I mean, it's a very secure area, and they really were proactive, as a matter of fact, in saying, are you safe? Do you need help? Do you need support? Yeah. And so I think that's been incredible.
Well, and thank you for being honest with them. That starts to shift the needle. As much as neither of us want to be in that position.
It was definitely
cool.
hard.
I want to shift the needle. No, I don't. I don't want any of this. But
well, especially when you're a leader of a large group too. I mean, you really do. I mean, you fear loss of confidence from people. And it is. It's very. While it's humanizing, it's almost dehumanizing at the same time. It's like both. And so the irony of that is, that was tough. Yeah, so those conversations were difficult.
They're not fun.
Yes.
But I always think about, even in my own experience, when I had my gallery, I would, be writing a commission check and I'd invert numbers because my brain just was not working.
Right.
And so I think about people in medicine or in leadership or... my law enforcement that still receives letters from my stalker to this day, and just that mental toll and the job you're doing, that inverted number can make a huge difference.
Oh, yeah,
and
absolutely.
Then to have people then be aware of your situation and know that can happen, that's so challenging.
Yeah, and I think that's why it was important for me to step away. I had a very higher level leadership position that I had to make a lot of quick decisions, important decisions, and I think it wasn't fair, because I was having the same sort of brain fog, mental, like sludge. It felt like I was operating in sludge every single day, and it's not compatible with a job like that. So yeah, I think the healing process is important.
Well, heck, I mean, I think half the time it's like that's how I ended up in this work is I'm like, I can't really function in like the 9-to-5 structure anymore.
And so look at that impact, right? Like I am now looking at redefining my entire career based on this experience. And I have to say, like, it was even scary to come on today because you are also vulnerable. You're sharing the story. I don't know if, people that know this person will see it, or like any of the information that is disseminated is scary if you put yourself out there. And so I think that the stand up that you have as your website, that was the reminder of this is important work, and I have to do it anyway, even if it is scary.
I mean, I think that like for myself and probably you as well, it's like I'm lucky to have made it through, and there are millions, 8 million a year that are not getting heard. And so like the littlest light we can shine makes a huge difference, and also helps myself navigate in my own mental health world and my own psychological world of being like, okay, this works. I can work in these very different worlds and, do trauma-informed graphic design over here and do, podcast or go speak or do these quiet things and maybe make some art on the side, and like that works, and that's the best I can do for as long as I can.
Yeah, and I think another irony of the stand-up piece is, and to share the story, is part of the that fight to get a final order, and then realizing that this justice system is not set up to support victims. Really, the final message is put up with it. Pretend like it doesn't affect you. That's the way to get at it, right? That's the way to really get them to stop, is just don't feed it. And so I think that's part of that, the irony of sharing the story does sometimes feed the actual actions of stalking. Oh, I'm getting something. Oh, I'm getting a response. And so, there is a bit of a conflict there. And I think that's why it's so important for our legal system to support victims.
Absolutely. We have a criminal justice system. So they are innocent till proven guilty, and we are guilty till proven innocent. And like, I just keep coming back to that thought.
Yeah.
And I know, and like when victims reach out to me, like, should I block? Should I not block? Should I report? Should I not report? I'm like, there is no right answer.
Yeah.
Our gut is the only answer.
Right.
And I don't think that anything I did or you did would have changed where we were and how we're sitting here today. And I always come back to that. I'm like, that person's psyche, whatever it might be that's driven them to do this, is their own thing.
Right.
Me having a response, whether it be loud or quiet, is not changing that.
Yeah, that's a good point.
Like, I get to feel safe as much as I can.
Right.
And for as long as I can, like I said. I know that your offender is incarcerated as well.
Yeah.
And it's nice to, I always call it my sentence of freedom.
Yeah.
Because I always think back on like when that sentencing day, I was like, you're sentencing both of us.
Yeah.
You're not just sentencing him.
Interesting. Yeah.
You're sentencing me as well.
Yep.
And I'm going to enjoy my sentence of freedom and do whatever I can with it for as long as I can. But it is really challenging.
It is.
And I think, like, could you speak to, for me, I always kind of think of like, if we want to use that mailbox example that my judge used, there was a start and a finish to that mailbox getting smashed. There's a start and finish to so many crimes. There's the assault, it's done. There's a car accident, there's whatever it might be. But with stalking, I feel like there is no end. Even if they never contact me again, there is no end.
Yeah, it's cumulative. I think it actually gets worse unless you do some really, really active, focused healing. it's important in my story that my stalker actually was incarcerated for a different, non-related at all, and it was financial, and that alone was a tough message to swallow, because it was, to me, I heard, well, money is more important than your safety.
Yeah.
And so it really, I have probably more to fear once he is released than before. And so I'm still anticipating that. So it's a sentencing. I have it, in my mind as a calendar. I know when that's going to happen. I also know that folks are often out early and on supervised release, and a lot of the stalking.
Get me started on that one.
Right, and a lot of the stalking happened while he was on supervised release from a previous incident. So it is tough.
Yeah. And that is like such a, for you and knowing your story a bit, like not only were you a victim who had to prove your innocence, and thank goodness for the Community Justice Center for helping with that, but also, he's incarcerated for a crime not related to stalking.
Right.
And because stalkers don't get convicted in Vermont, sorry, just a little heads up to everyone, that doesn't happen, so.
Yeah.
You spoke to that a little bit, but especially like dealing with like when you came into the Community Justice Center, what was that like to finally be acknowledged as a victim instead of a perpetrator?
I can say within 3 minutes of our conversation, it was like this just weight and just a sense of immense relief and gratitude. I can't describe it, actually. I kind of, I broke down because I went in just in that protective, like, oh my gosh, what's going to happen? And instead, I was received with understanding, that it, really all they repeated was, it's not your fault, it's not your fault, it's not your fault. And, still I have a hard time believing that, it really just inherently, you try to figure out what happened, how did this happen? And what could I have done differently? So it was just 3 minutes into it. So imagine what, an hour or 2 hours, 3 hours, and, they were open to maintaining that connection with me, and just the sheer fact of, give us a call whenever you need.
Yeah. And this was
we're here
with Lauren,
for you.
correct?
Yeah.
How did you come to the Community Justice Center? How did you find them?
They found me.
Okay.
Yeah, they found me because I was talking to the state's attorney's office, because my case had been referred from the medical board to the state's attorney's office. And they reviewed it with the state's attorney folks and said, it seems a little off. Let's get involved.
Yeah.
So they found me.
Love that.
Yes.
It's interesting, and so your case, when that really came, I've designed websites for the restorative justice centers, and, been very familiar with their work, and your case, I was just like, oh, okay, I like this, because I always thought of it a lot of offender reparations, accountability, all of that, and then to see this other side really opened up my eyes. So thank you for opening up my eyes.
It did for me as well. I didn't know a lot about it, and when I read about it online, because that's what I do, that's what we all do, we go to Google, right? What is restorative justice?
The more I know, the more I can control. Yes.
And so what I read too was it really is, the perpetrator, making amends to the victim, and I thought, oh my God, I'm the perpetrator now. I have to now see the victim. Now I have to see my stalker as the victim. It was just a complete, had mind-blowing thought. And so when I first talked to them, my first thing was I cannot, whatever the rules are, I can't be in the same room with this person. This is the reason why. Yeah. And I gave my story, and she said, no. No. So.
But it also speaks to how much stalkers use the criminal justice system to commit the crime.
Absolutely.
And domestic violence as well. It's across the board. If you get that protection order, they'll take you back to try and get it denied. They will use the criminal justice system to see you and commit the crime. And I said, once again, I was very fortunate. Like my first judge, years later, when she retired, I found out like her background was in victim support and victim-centered services before she became a judge.
That's great.
And there was one time where he brought me to court to get the protection order revoked, and she was just like, "You will not use my court to recommit this crime."
That's awesome.
But a very, very special judge, right? Who understood and could see that and call that out, unlike so much of what we're seeing now. And I don't know if you agree, but for me, one of the biggest things I think needs to change within stalking is judicial training.
Yeah.
Like we're training cops, we're training advocates, we're training all these different professionals, and we get to that point, and then they're saying, well, I don't see the threat of harm. Yeah. And like without judicial training around stalking, we're going to keep having this loop of a conversation.
Right. I think that's absolutely true. And also, just the sheer wording in the statute. I mean, there's very simple changes that can occur. And I have to say...
You want to change it?
Yeah, I would. I would love to do that.
Let's do it.
Yeah,
I'm not joking.
No.
I maybe have some emails.
Yes. I mean, that is what I hope to at least support and help with. I mean, I have... As much as, I have negative experiences with the judicial system, I've had positive in the sense, the Community Justice Center, but also, the federal prosecutor that was involved in my stalker's case, incredibly supportive, brought in, folks that knew a lot about trafficking, stalking. Actually, a person who was involved in even generating the statute for revenge porn, for instance.
Yep.
And that is, and to hear him talk about it, it was inspiring and empowering. And this is one person. Can you imagine if we had multiple of those people? And I think we just need to start listening to them because they have so much experience. And this particular fellow that I met, had 10 different cases, and they were all just incredibly, when you hear them, just incredibly important, the trafficking children, and you thank God that there are people out there that really are passionate about this and knowledgeable and can, speak to this. He actually went with me to the police office in my local community to help me, to support me. Like that.
Amazing.
It was incredible. So for all the bad, there are these pockets of incredible goodness and knowledge and support. So I think it's a matter of disseminating.
Yeah.
That.
And a matter of, I think we're very fortunate. I know we need to start to wind down, but I think we're very fortunate here in the state of Vermont that, our legislators are our neighbors. Mm-hmm. And, I think back on now retired Maxine Grad, who was really at the forefront of victims' rights here in the state. I just sent her an email when I first moved here, and we got together for coffee. That doesn't happen in a lot of other states, but it doesn't mean it can't. And I think that's a big thing is to email your legislators. Yeah. I emailed one the other day. I was just I would like to see this bill get passed, and they're like, actually, we just were looking at that in New York. I'm like, cool, let's do this. I don't see the big deal. And they're like, yeah, we're going to put that on the agenda. I was like, great, sounds good. That just, don't be afraid to send the email. Yeah. Don't be afraid to stand up. Don't be afraid to tell your colleagues. That creates change, even if it's just an awareness and conversation. Yeah. So thank you for doing that.
It's a grassroots state. You can really do that powerful work.
It truly is. Yeah. So as we wind down today, you're taking a leave of absence. Congratulations. Big, bold thing. Scary, terrifying.
Yeah.
What else are you doing to kind of work on your own healing, for lack of a better term?
A lot of internal work. Specifically journaling. I have a fantastic support, therapist. Going group therapy. Folks that have had similar experiences and reading books. I think that nervous system regulation is what I'm focused on right now. Mm-hmm. So trying to minimize, the external grabs and really focus on what I need to stabilize. Because I'm working to do is expand this window of resilience. It was explained to me by folks that have been supporting me as, we have this window of resilience that when we're traumatized, when we're activated, when our nervous systems are shut down and we're in that freeze response, you're paralyzed, you're so fearful that you just can't do anything, that you just need to start expanding that window of resilience. And so that's what I'm working on through yoga and somatic experiencing. So working with, in fact, it started with a fellow named Aaron Kennart, who is leader of embodied leadership at the University Medical Center. And he does weekly sessions with people as far as somatic experiencing and actually regulating, learning to recognize in your body, what you're feeling, being able to describe it, being able to feel it and have it, move through. And
amazing.
It's awesome. So that has been my new passion. And so I'm hoping to potentially take that path and be able to support that effort at the hospital so that we can then support the staff and healthcare professionals that are dealing with other sorts of injuries, to their nervous system, so that we can all regulate, because we are essentially co-regulating. I mean, we're humans, right? So we're constantly exchanging energy, and I think that we have to start with ourselves. So that's what I'm focused on now.
Absolutely. Well, thanks for giving me some of your energy today. I know I feel a little bit bigger and bolder. So thank you.
Thanks. Thank you.
I always like to kind of end on like a positive note. Is there anything you would like to say to victims, survivors of stalking specifically?
Yes. Well, I mean, I am so grateful to have had the opportunity to share my story, even though, it's hard and I would have not thought it to be necessarily therapeutic. I think being able to, get plugged in to folks that are knowledgeable and understanding and supportive, is just making that connection. It makes a world of difference. And you don't know they're there, right? And so I wouldn't have known had they not found me. And so I would love to be able to share those resources with folks that aren't, that don't know that they have those resources available, because it is life-changing in these circumstances. So.
Yeah, I mean, I always think of this episode's obviously very special because we have a very shared experience, which I don't normally have with my guests, but so this is very special for me. But it's like, I think, statistically, like 1 in 3 women and 1 in 6 men experience stalking in the course of their lifetime, which means there's a lot of us out there that understand, whether it be for a week that they experienced it, a month, a year, years, 15 years, we all understand that cumulative harm that it does. And so I think the more that we're open and honest and share, like, we have no idea the reach that makes and the difference it makes of just knowing you're not alone. So thank you.
Absolutely. And it's generational too. If we don't acknowledge it in ourselves and our circumstances create the boundaries, and that has been by understanding it's not my fault. I was a victim. I'm able to create boundaries. I'm able to teach my girls to create boundaries. So it's not transferred in generational trauma, right? Like,
exactly.
So it's so important. So I appreciate your having me.
Thank you.
Thanks.
So thank you so much for being here, Dr. Alex. That kind of winds us down for today. As always, like, if you have any questions, you can email me on at standupresources.com. And thank you so much for being here on the Mend. Be well and continue to mend.